Hello, my friend. I'm Dr. Linda Parker, and today I want to talk to you about something that almost no one explains clearly after 60, but that can change the way you age more than any cream, supplement, or special diet. The pills you take every day without thinking. This is a calm, honest conversation about three very common types of drugs that many people continue taking into their 70s. When their bodies have changed so much that those same pills may be doing more harm than good. My goal is not to frighten you or to tell you to throw anything in the trash. My goal is to give you clarity, so you can sit in front of your doctor and say, "Let's review this together." I want to understand what I'm taking and why. For years, a quiet myth has been repeated in many clinics and waiting rooms. If a medication worked for you at 55, it will work the same way at 75. That sounds logical, but it is simply not true. Your body at 70 or 75 is not a weaker version of your younger body. It's a different body. Your liver processes substances more slowly. Your kidneys filter with more effort. Your brain is more sensitive to chemicals that affect balance and memory. Your blood pressure and circulation respond differently to dehydrating or sedating drugs. The same dose that felt mild at 50 can be overwhelming at 75. The problem is that most people are never told this directly, so when they feel dizzy, confused, or unsteady, they blame it on old age, not on the little pills lined up in the bathroom. Another huge issue is something we call multiple medication use. Many people over 70 wake up, open a box, and see a small rainbow of tablets and capsules waiting for them. One pill for blood pressure, one for diabetes, one for cholesterol, one for sleep, one for nerves, one for pain, another for the bladder, plus vitamins and herbal products. Each one was added for a reason, but very few doctors have the time to sit down and look at the whole picture. That means interactions are easy to miss. Two drugs might both lower blood pressure and together cause fainting. Several might slow the brain and together create a constant fog. Others might quietly strain the kidneys or stomach for years until a crisis appears out of nowhere. Before we go into the three groups of drugs I want you to look at before 75, I need to say something very clearly. Do not stop any medication suddenly because of a video, an article, or a conversation with a friend. Some medicines must be reduced very slowly to avoid withdrawal or rebound effects. Sudden changes can be dangerous. What I want for you is not impulsive decisions, but an informed, calm, planned conversation with your healthcare team. You have the right to ask, "Is this still the safest choice for me at my age?" The first group of drugs I want you to pay attention to are the pills that calm you down or put you to sleep. Sedatives and tranquilizers, especially a family often called benzodiazepines and their close cousins, as well as certain sleeping pills that act in a very similar way. You may know them as the small tablet your doctor gave you to relax your nerves, to help with anxiety, or to finally sleep 8 hours. Their names often end in PAM or LAM, and some sleeping pills are advertised as gentle helpers for insomnia, even though they affect the brain in almost the same way. These medications work by slowing the activity of your nervous system. In a young adult, for a short period, they can be useful in a crisis. A panic attack, an acute loss, a brief period of severe insomnia. In an older adult, especially when used every night or several times a day for months or years, they can slowly blur the edges of the mind. You may notice that your memory is no longer as sharp, that you lose the thread of conversations, that you struggle to find words, or that you feel heavy and unrefreshed in the morning. Your reflexes slow down, which means your ability to catch yourself if you trip is reduced. That is one of the reasons these drugs are strongly linked to falls in older adults. A fall at 30 is an inconvenience. A fall at 75 can be a fracture, a surgery, and a loss of independence. There is also the issue of dependence. The brain likes stability. If every night for years you give it a pill that forces it into sleep, it adapts. It begins to expect that external push. Over time, the pill that once made you sleepy may seem weaker, and the temptation is to add another half tablet or switch to something stronger. If you then try to stop suddenly, your nervous system pushes back hard. You may experience intense insomnia, shaking, sweating, irritability, or intense anxiety that feels worse than what you had at the beginning. This is not a sign of weakness. It is a sign that the drug has trained your brain to rely on it. What can you do if you are over 70 and using one of these pills regularly? The first step is awareness. Look at the name of your medication, ask your pharmacist which group it belongs to, and write down for your doctor how long you have been using it and at what dose. The second step is to ask for a tapering plan if it is appropriate for you. A taper is a gradual reduction over weeks or months, adjusting the dose little by little so that your brain can adapt. During this time, it is essential to build habits that support natural sleep. Going to bed and waking up at the same time every day, avoiding late heavy meals, limiting caffeine after midday, and keeping screens out of the bedroom. Gentle exercise during the day, a short walk in the morning light, breathing exercises before bed, and relaxation audio can all teach your nervous system that it is safe to let go without a pill. For anxiety and worry, non-drug approaches are powerful. Talking to a therapist, joining a support group, learning simple mindfulness techniques, or even writing in a journal every evening can help your thoughts slow down without sedating your body. In some cases, non-sedating medications may be used, but the central idea is this. After 70, long-term use of strong sedatives is rarely the safest option. Your brain and your balance are too valuable to be constantly slowed down. The second group of drugs we need to talk about are the everyday pain pills, known as non-steroidal anti-inflammatory drugs, often shortened to NSAIDs. These are the tablets many people take for arthritis, back pain, headaches, and joint stiffness. They are widely available without prescription in many countries, and because we see them on supermarket shelves, they feel harmless. It is very common for a person with knee or back pain to take one or two of these pills every morning for years just to be able to move more easily. These medications reduce pain by blocking substances in the body that trigger inflammation. In the short term, they can be helpful. The problem arises when they are used almost every day in an older body. They can irritate the lining of the stomach and intestines, leading to ulcers and internal bleeding. This bleeding is not always dramatic. It can be slow and hidden, happening over weeks or months with no visible blood. What you may notice instead is that you feel more tired, more short of breath when climbing stairs, or paler than usual. By the time blood tests are done, your iron stores can be very low and your red blood cells may be severely depleted. NSAIDs also affect the kidneys by reducing blood flow to these delicate organs. In someone with already reduced kidney reserve, this extra strain can quietly push the kidneys towards failure. You may not feel it until your legs swell, your appetite drops, or blood tests reveal a significant loss of function. These drugs can also cause the body to retain salt and water, raising blood pressure and worsening swelling in the ankles or shortness of breath. For someone with heart disease, this extra fluid can be especially dangerous. The complicated part is that these painkillers sometimes hide in combination products. Cold and flu medicines, all-in-one tablets for aches and fever, and some menstrual or migraine remedies may contain them. That means you might be taking them more often than you think. If you are over 70 and taking any pain pill, it is important to know exactly what is inside. Reducing their risk does not mean ignoring your pain. Chronic pain steals energy, mood, and mobility, and it deserves a thoughtful plan. Safer options may include using paracetamol, also known as acetaminophen, on a schedule that is appropriate for your liver health. Switching to pain-relieving gels or creams applied directly to the painful joint, or using occasional short courses of stronger drugs under close supervision instead of daily unmonitored use. Non-drug strategies matter as well. Gentle strengthening exercises around the affected joints, guided physical therapy, water aerobics, heat or cold packs, weight loss when appropriate, and supportive footwear can all reduce the intensity of pain. To turn this into action, bring your pain medications to your next appointment and ask your doctor 3 clear questions. First, given my age and my kidney and heart function, is this the safest long-term option for my pain? Second, are we monitoring my kidneys, blood pressure, and blood counts often enough? Third, what alternatives could we try to reduce my dependence on this pill? When you ask questions like this, you invite your doctor to move from automatic prescription renewals to a real, thoughtful review. The third group of medications that I want you to examine before 75 are those with strong anticholinergic effects. That long word simply means that they block a chemical messenger in the body called acetylcholine, which is important for memory, attention, gut movement, bladder function, and many automatic processes. Drugs with strong anticholinergic action show up in several places. Older allergy and sleep medications that make you very drowsy, certain bladder control pills used for urgency or leakage, and some older antidepressants that are sometimes prescribed in low doses at night for pain or insomnia. In a younger person, a short course of one of these drugs might only cause a dry mouth or a little constipation. In an older adult, especially when combined with other medications, their effects can be much stronger. They can slow thinking, blur vision, cause confusion, create a feeling of being out of it, and greatly increase the risk of falls. They dry out the mouth, which affects dental health. They slow the gut, leading to uncomfortable constipation. They can cause difficulty starting urination or emptying the bladder completely, especially in men with prostate enlargement. When you add these effects together in someone who is already more sensitive, the impact on daily life can be significant. One of the most worrying concerns about long-term exposure to strong anticholinergic drugs in older adults is their effect on memory and thinking. Many people are surprised to learn that the little pill to help me sleep or the old allergy tablet that knocks me out at night may be quietly contributing to mental cloudiness. The early signs are often subtle. You misplace objects more often, lose the thread of what you were doing, or repeat questions without realizing it. Family members might describe you as more forgetful or not quite yourself. It is easy to assume that these changes are an unavoidable part of aging. Sometimes they are not. Sometimes they are the result of a very specific chemical load that can be reduced. So what can you do if you suspect you are taking one of these drugs? First, ask specifically whether any of your medications has strong anticholinergic properties. Pharmacists are usually very knowledgeable about this, and there are tools that health professionals use to calculate your total anticholinergic burden. Second, ask whether there are safer alternatives. For allergies, there are newer antihistamines that do not cross into the brain as strongly and cause far less sedation. For bladder urgency, pelvic floor exercises, bladder training techniques, and newer drugs with milder profiles can often replace older, heavier options. For sleep, behavioral approaches should again be the foundation, rather than relying on an old-fashioned sedating tablet. When we put these 3 groups together, sedatives, everyday anti-inflammatory pain pills, and strong anticholinergic drugs, we see a common pattern. All 3 are often started for valid reasons: stress, insomnia, arthritis, allergy, bladder problems. All three are often continued automatically for years, even when the original problem has changed. And all three have risks that increase with age, especially for balance, thinking, stomach, kidneys, and heart. That is why I encourage my patients in their 70s to perform what I like to call a medication house cleaning. A medication house cleaning is simple, but powerful. You choose a day when you are not rushed. You collect every single product you use: prescriptions, over-the-counter pills, herbal capsules, vitamins, sleep aids, pain relievers, allergy tablets, bladder pills, and tonics. You put them all in a bag and bring them to your doctor or pharmacist. You place everything on the table and say, "I want to review all of these with you. Which ones are essential for me right now? Which ones are risky at my age? Which ones could we reduce, replace, or eventually stop?" This is not confrontation. It is partnership. You are inviting your healthcare team to see the whole picture instead of just one slice. Let me share 3 short, typical stories that show how powerful such a review can be. The first is about a man in his late 70s who had been taking a sedative for sleep since his 50s. He considered it part of his identity. "I'm the type who can't sleep without a pill." Over the years, he became more forgetful and stumbled several times on his way to the bathroom at night. After a careful medication review, he agreed to a very slow taper of his sedative while learning new sleep habits. 3 months after stopping, he reported that he felt more awake in the morning, his jokes had returned, and he had not fallen again. His insomnia did not disappear completely, but his clarity and confidence came back. The second story is about a woman in her mid-70s with long-standing knee pain. She took an anti-inflammatory pill every morning with breakfast. Her blood tests began to show a gradual decline in kidney function, and she often felt exhausted. When a new doctor reviewed her medication list, they connected her kidney strain and her chronic anemia to the pain pills. Together, they designed a different plan. Topical treatments, scheduled paracetamol, low-impact exercise, and occasional short courses of stronger pain relief when absolutely necessary. Her kidney function stabilized, and her energy improved as her blood count recovered. The third story is about an older man whose family feared he was developing dementia. He was inattentive, forgetful, and sometimes disoriented. During a medication review, it became clear that he was taking an old sedating antihistamine at night to help him sleep, plus a bladder pill with strong anticholinergic effects. His total anticholinergic load was very high. Over several weeks, under medical supervision, these drugs were replaced with safer alternatives and non-drug strategies. His orientation and memory improved noticeably. He still had age-related changes, but the heavy fog lifted. None of these stories are magic. They are simply what happens when we respect how sensitive the older body is and remove substances that burden it unnecessarily. Before adding a new pill, it is often smarter to ask, "Is there anything here we can safely remove or reduce?" That question alone can protect your balance, your kidneys, your heart, and your brain. If I had to compress everything we have talked about into a single sentence for you to remember, it would be this: the medicines that once helped you may quietly harm you if you carry them unchanged into your 70s. So it is essential to review, adapt, and sometimes let go of them with professional guidance. Aging well is not only about gaining more treatments. It is about keeping only what truly serves you at this stage of life. And I want you to hold on to one more thought. It is never too late to protect your future. Even if you are already over 75, even if you have been taking the same pills for decades, you can still sit down with your doctor and say, "Let's look at this again." I have seen people in their 80s become steadier on their feet, clearer in their thinking, and more energetic simply because we reduced or changed their medications. Your story is not locked in by what is written on your prescription label today. If this conversation made you think differently about your medications, I invite you to take one concrete step. Choose one trusted professional, your family doctor, your geriatrician, or your pharmacist, and ask for a full medication review. Bring your questions, bring your curiosity, and don't be afraid to say, "I want to understand." If you think someone you love might be affected by the issues we discussed, share this message with them. Sometimes a simple conversation is the beginning of a safer, brighter decade of life. Thank you for spending this time with me. I'm Dr. Linda Parker, and I hope this talk has given you more confidence to take an active role in your health. If you'd like to keep learning how to age with clarity, strength, and dignity, I invite you to stay connected, keep asking questions, and join me in future conversations. Your body has worked for you for many years. It deserves medicines that truly support it, not ones that quietly hold it back.